The bowel cancer screening programme is a nationwide programme.
And it's for anyone between the ages of 50 and 74.
Participants will get sent a kit through the post in which they test their poo with. The kit is then sent back to be tested, and it's tested for the presence of blood.
My experience of the bowel screening process started off when I got a letter. I've only just turned 50. I was pleasantly surprised because I think it's a good thing and a positive thing to get checked.
The kit basically is like a little kind of tube. It comes apart and there's a tiny kind of dabber. Once you've done a poo, basically you just dip the tip of that into the poo. You need a minute amount, pop the lid back on, sign it, date it, and then you just send it back in the prepaid package.
Initially I thought it'd be complicated, but then after reading the instructions, it was a very simple, literally 40-second process.
And having your results back quite quickly really does give you peace of mind.
So it was around about 2 years ago when I first participated in the bowel screening programme, and the results were negative, which was fantastic. I started to experience some symptoms in the following year, and through the investigations that were completed, I was diagnosed with bowel cancer. I think the key message there is that just because you've gone through a bowel screening process and received a negative diagnosis doesn't mean that you can ignore any potential symptoms of bowel cancer that you may experience afterwards. So I think you've just got to really pay attention to your body in the now, not the yesterday.
At the time I was anemic, losing a lot of weight and just not feeling great at all. By the end of 2023 I was not in a good place at all. And it was a bowel cancer. Stage 3, and it was in my rectum. The world just came crashing down. 4 cycles of chemotherapy and 5 weeks of radiotherapy, and then the operation at the end of the year. I kind of made my own little team along the way of people that I needed to help with the process. So I just kind of made my own little army of people that came along and helped, which was really helpful. I think if I was left later, then it would have been a completely different story.
I think it's really a case that pay attention to your body. Be looking for things that perhaps aren't quite normal. Just get yourself to the GP as soon as you can. Be persistent to get the appointment. Hey, be embarrassed for a couple of minutes if it's going to save your life.